Welcome to Module 1. This module will give you a basic understanding of prediabetes and diabetes. Our goal is to help you become familiar with the terms you'll be hearing, understanding the blood work you'll be doing, and what puts you at a higher risk of developing diabetes and prediabetes. So let's begin this module by explaining why prediabetes develops. Prediabetes is defined as a condition where your blood sugar levels are higher than normal, but not high enough to be classified as diabetes. It often acts as a warning sign to improve your overall health and nutrition before developing type 2 diabetes. This happens due to chronic high amounts of sugar, aka glucose, in the blood, which causes a hormone called insulin to malfunction. This is called insulin resistance, which you've most likely heard of. We will dive deeper into how insulin resistance develops a bit later in the course. Because insulin can't do its job fast enough to keep up with the levels of sugar in the blood, prediabetes develops. If insulin resistance persists long enough, type 2 diabetes can develop due to your body being unable to produce enough insulin or not responding properly to the insulin it does produce. Type 2 diabetes usually develops due to lifestyle factors such as poor diet and lack of exercise, hence why it is sometimes called adult onset diabetes. However, the rate of children developing type 2 diabetes has skyrocketed in the past 50 years. Symptoms for both prediabetes and diabetes are very similar. If you're experiencing any of these symptoms, it could be a sign to get your blood sugar checked for potential prediabetes. These signs and symptoms include, but are not limited to, blurred vision, increased hunger, fatigue, frequent urination, and increased thirst. Now, some symptoms are sneaky and can go unnoticed, especially if your blood sugar fluctuates frequently. As you adjust your diet and activity levels, which in turn manages your blood sugar levels better, you'll become more aware of these symptoms. It's very easy for some of these symptoms to be viewed as normal if they occur frequently enough. If you experience any of these symptoms though on a regular basis, it's best to get your blood and urine checked for relevant diabetes markers, which we'll discuss in future lessons. Now, let's talk more in depth about some of those lab values I mentioned earlier.